Social Welfare History Project by Sarah Oshoko. Hello, I'm Sarah Oshoko, and today I want to present to you my thoughts concerning the social welfare processes within the United States. As I have learned from this course, the struggle for human welfare in the United States history has been complex and it's a continuing process. America has had a lot going on socially and economically from the period of 1990 to 2016. There was an addition to the concept of globalization and the wealth distribution shift. The impact of globalization on inequality and income disparity. Globalization seems to have had a distinctly positive impact on the world itself and on the individual incomes of the citizens of the various states of the world. However, globalization and its subsequent impacts leave an imprint on income disparity as well. Their intervention can't and should not be dismissed. Globalization and its impact on income inequality has at least two sides to it, thus provides separation based on income classes. The situation is not the same around the globe and for every country. It depends on the state's policies concerning the economy, labor market, and education. Globalization versus income inequality is an educated debate lingering throughout income levels and education levels. Globalization has progressed economy in several parts, but the gap in income is widening between countries and within countries. The impact of globalization on income inequality is a consequence of advanced technology, the difference of profit people make from trades, and the changes of the market in terms of services and work. Next is a diagram from the future of globalization and income inequality. Number one, the future of globalization largely depends on how countries respond to the challenges it poses. Next, technological advancements such as automation and artificial intelligence are likely to have a significant impact on income inequality in the future. Next, education and skill development are essential for ensuring that workers are able to adapt to the changing demands of the global economy. Next, the role of the labor market institutions such as unions and minimum wage laws is crucial in ensuring that workers are able to share in the benefits of globalization. And finally, it is worth noting that income inequality is not just a problem for developing countries. Also, the increasing diversity of the United States was coming into focus. Diversity is defined as the practice or quality of including or involving people from a range of different social and ethnic backgrounds and of different genders, sexual orientations, etc. Healthcare reform. The enactment of Obamacare in 2010 is considered one of the high points of President Barack Obama's presidency. The Affordable Care Act. Barack Obama's Affordable Care Act ensured that millions of Americans received coverage and mandated that insurance companies could not deny coverage due to pre existing conditions. Why is the Affordable Care Act so important? According to the American Public Health Organization in 2024, millions still need insurance. Though the Affordable Care Act has helped about 20 million people get health insurance, about 29 million still lack coverage. Unsustainable spending. Health care spending represented 17.7% of our gross domestic product in 2019. Lack of emphasis on prevention. Today, 7 in 10 deaths in the US are related to chronic diseases such as obesity, diabetes, high blood pressure, heart disease, and cancer, which are largely preventable. Additionally, 90% of our healthcare dollars are spent treating such diseases. However, only 3 cents of each healthcare dollar spent in the US go towards prevention. Poor health outcomes. The US spends far more on medical care than any other industrialized nation, but ranks 28th among 36 OECD countries in terms of life expectancy. Health disparities. While inequities related to income and access to coverage exist across demographic lines, population-based disparities are impossible to deny. The Affordable Care Act is an important step forward. The Act's support make health insurance more accessible, increasing the number of covered Americans, funding community-based public health and prevention services, aiding in research, and monitoring essential health indicators. With these steps, the ACA begins to bridge gaps, access preventative care, improve health outcomes, and lower the nation's expenditure on healthcare. On the other hand, the Affordable Care Act faced considerable obstacles, including numerous court challenges and repeal attempts. Social welfare reform. For many years, there has been a heated debate for and against social welfare reform in the United States. While some people believe the system offers too much aid and creates a culture of dependency, others are of the opinion that the system is inadequate and does not offer enough help. Welfare reforms are changes in the operation of a given welfare system aimed at improving the efficiency, equity, and administration of government assistance programs. What are examples of social welfare? Some of the major federal, state, and local social welfare programs are Supplemental Security Income, Supplemental Nutrition Assistance Program, also known as SNAP, Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, and Temporary Assistance for Needy Families, including pass-through child support. The most recent trends indicate that there is at least some agreement among policymakers that the current system needs a complete overhaul to better meet the needs of low-income families and individuals. Public education and affirmative action. The fight for social equity regarding public education and affirmative action policy remains one of the greatest unsolved problems in America. Affirmative action is defined as a policy aimed at increasing workplace and educational opportunities for people who are underrepresented in various areas of society. The progress made in the past few decades has been remarkable, but a large number of schools remain discriminatory, and students of color continue to be denied access to education. In theory, federal law permits the limited use of affirmative action in admissions for purposes of promoting diversity in higher education. In practice, the federal courts have, over the years, significantly narrowed the circumstances under which colleges and universities may adopt race-conscious admissions programs. There is a growing belief that affirmative action policies are unnecessary and are facing legal scrutiny. Social movements. The social movements that come to mind in this period are the Black Lives Matter and the Fight for $15 movements. Black Lives Matter. The Black Lives Matter movement has brought awareness to the racism and discrimination, as well as police violence perpetrated against African Americans. The Fight for $15 movement. The Fight for $15 movement, on the other hand, has fought for a living wage as well as decent and humane working conditions for the low-paid workers. Policy advocacy. An example of a policy that has received a lot of attention from advocates in the recent past is the DREAM Act. The DREAM Act essentially provides a route to citizenship for young undocumented migrants who were brought into the United States as minors. Some of the advocacy approaches used to advance the DREAM Act include lobbying, grassroots movements, and social media advocacy. What I have learned from this course furthers my understanding that the drivers for social welfare improvement in the United States have been social movements and advocacy groups. These groups help to give voice and attention to the concerns and realities of disadvantaged groups and communities. Barriers to social welfare. As it has been previously mentioned, there has been progress made on social welfare. However, there are still major barriers to it in the United States. These include systemic discrimination, such as racism, sexism, and homophobia, in addition to the widening divide between the wealthy and the poor, and the growing impact of wealth on politics. Expectations versus reality. I'd like to believe that my expectations will be met, and the United States will continue to work towards being more fair and just. Further, I hope that social movements and advocacy groups will push for policies that provide actionable relief to the targeted communities. My concerns are that the barriers undermining social welfare will continue to grow, leading to increased division and inequality within the United States. Suggested next steps. Concerns regarding the United States social welfare system require family, organization, and government cooperation to collectively shift policies that impact the well-being of neglected groups. Policy change must focus on providing universal health care, free college education, and a minimum standard of living. Supporting social movements and advocacy groups, as well as bottom-up organizing and activism, must also be supplemented. Thank you for watching.